Good afternoon, everyone, and thank you for being here today. My name is Darryl Reid, and I'm the Fire Chief for Vancouver Fire Rescue Services and also the General Manager of the Vancouver Emergency Management Agency. I'd like to acknowledge that we're here on the territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. We wanted to bring everyone together today to talk about the proactive steps the City of Vancouver is taking to deal with the ever-evolving COVID-19 situation. As you're all aware, the situation globally and in BC is changing very rapidly as cities and countries respond to COVID-19, and we are doing the same here in Vancouver. The Vancouver Emergency Management Agency immediately began reviewing and updating pandemic plans and business continuity plans. The Emergency Operations Center was activated as of Monday, March 9th, 2020, and a dedicated team remains on site daily to deal with the evolving COVID-19 situation. While a pandemic has been declared, Vancouver Coastal Health and the BC Centre for Disease Control have said the risk of transmission in Vancouver remains low, and the City of Vancouver will adjust our response based upon updated advice from public health professionals. We ask that all residents implement and follow the advice of public health officials, including washing your hands thoroughly using soap and water for a minimum of 20 seconds, sneezing and coughing into your elbow or covering your mouth, and very important, if you feel sick, stay at home. Symptoms include fever, coughing, headache, and/or shortness of breath or difficulty breathing. If you think you have these symptoms, call 811 or your doctor. In line with provincial and federal guidance, if you have recently returned from abroad, including the United States, please self-isolate. Thank you for your help in keeping yourself and fellow residents safe. I'll now pass you over to Paul Mulcree, Deputy City Manager, who can tell you more about the city's response.
Thanks, Chief Reid, and good afternoon, everyone. The health and safety of the public and city staff are our top priority at this time. We're working with our partners at Vancouver Coastal Health and the province to take every precaution to prevent and slow the spread of COVID-19. The City of Vancouver is currently reviewing all events and programs. All gatherings with more than 250 people will be cancelled or postponed as per the direction from the Provincial Health Officer, and we're reviewing all of our events to understand the risk and mitigate those risks as much as possible. This includes city-run events, permitted events, and gatherings booked by third-party organizers. We've increased our cleaning protocols at all of our public facilities and are posting signage at all of our facilities, directing both members of the public and staff to stay away if they're not feeling well. We know how important community facilities and services are, and we're taking steps to ensure they remain open as long as possible. However, our community services and programs may be adjusted over time as the situation evolves. We remain committed to providing essential services to the city. I also want to address and share our concern for vulnerable residents, individuals who may be living in shelters, single-room occupancy buildings, and on the street in our city. In particular, we're concerned with how we can support those individuals who may be ill or exposed to COVID-19 and expected to isolate themselves. Our foremost priority is the continuity of essential services that the City of Vancouver delivers to vulnerable people, our non-market housing operations, our food and hygiene services that we deliver at our 3 community centres in the downtown, and our outreach services. We want to ensure that we're prepared to continue those services, managing with reduced staff and supplies over the course of this outbreak. We are also increasing our cleaning protocols and making operational changes to mitigate the exposure risks to patrons and our staff. We're in contact with nonprofit agencies and neighborhood groups operating in the downtown east side regarding their capacity to assist in this effort. Where nonprofit agencies indicate that they are able to assist, we will do whatever we can to support them with that. We are also in close contact with BC Housing and Vancouver Coastal Health, looking to understand their plans and how the city can contribute to support those. If the province or health authorities indicate a need for support from the city, we'll do whatever we can within the constraints of our staff availability and safety in relation to any plans for new and expanded services in this neighborhood. Again, our priority is to ensure the continuity of essential services as long as we can and protect, as far as possible, the safety of the public and our staff. And with that, I'll now hand it over to Malcolm Bromley, the General Manager of the Park Board, to speak to the Park Board's response.
Thanks very much, Paul, and good afternoon to everybody. At the Park Board, the health and safety of our patrons and our partners and our employees is always top priority. And as such, we are monitoring the COVID-19 situation closely and responding quickly. While Vancouver Coastal Health has informed us that the risk of COVID-19 remains low, we have been taking steps within our system to address immediate concerns as well as plan for more urgent action if required. In terms of events, we have reviewed all of the Park Board events that are scheduled to take place between March 13th and June 30th of this year. And we're comparing them against the provincial criteria on exceeding not 250 people. As a result, we've canceled 2 events at this time. The Stanley Park Easter Train, which was scheduled to operate from April 9th to the 13th, and also the Easter Expectation at Van Dusen Botanical Gardens, the Easter egg hunt every year, from April 10th to the 12th. We will be reviewing events that take place from July 1st onward, but we're not canceling or postponing anything past June 30th at this point. We will, however, be taking direction from the Provincial Health Authority, and summer events could be impacted. We will be offering full refunds to anyone who have already purchased a ticket for any of our paid events that have been canceled. Now, in terms of community centers, currently all Park Board community centers, fitness facilities, pools, rinks, sports fields, and other facilities that we operate are open to the public for regular use, with the exception of steam rooms and saunas, which are closing for precautionary measures until further notice. We have taken steps to limit access to our 2 largest pools, Hillcrest and Killarney. The maximum attendance is 250 patrons, including staff. And this was actioned last night at 7 p.m. We've also initiated an informational awareness campaign at each of our facilities to reinforce the importance of cold flu prevention protocol, hand washing, staying home if feeling ill. We've introduced enhanced cleaning protocol at all of our sites in high traffic and common areas. We continue to take the lead from the provincial authority on risk to public, and we'll be monitoring any new advice on protocols very closely. The other area is programming. We're coming up to spring break, and currently all Park Board regular programming, including spring break camps, are running as scheduled. We are developing an action plan should we need to cancel or postpone programming. In the event that programs are canceled, we are working with our community center associations, our partners, to ensure that patrons receive a full refund. Anyone who chooses to proactively withdraw from a Park Board program during this time will not be penalized for making an individual choice about their health and will be offered a full refund. We have seen attendance in some of our senior citizen programming decline over the past week, and we understand that some individuals are making personal decisions about whether or not they feel comfortable attending their regularly scheduled activities. In terms of other Park Board operations to date, parks, park washrooms, marinas, concessions, golf, etc. have not been impacted by this pandemic. I will now hand over to Christina DeCastel, the Chief Librarian, who will inform you of VPL's response. Christina?
Thank you, Malcolm. I'm Christina DeCastel. I'm the Chief Librarian at Vancouver Public Library. The health and well-being of our patrons, partners, and employees is always the top priority at Vancouver Public Library. Our staff are part of this team here who are leading the response to COVID-19. They ensure the library is acting upon the most up-to-date information and ensure our actions are proactive and appropriate. We continue to welcome the community into our facilities and are taking precautionary measures to ensure the health and safety of the general public, our patrons, and our staff. To date, we've taken the following proactive steps at our facilities. We've implemented an enhanced cleaning schedule and protocols for the common and high traffic areas. We've posted informational print materials throughout our facilities that encourage community members to wash their hands, cough into their sleeves, and stay home if they're sick. We're also providing disinfectant to the public in our locations, especially for high traffic areas such as public computers. As has already been said, this situation is dynamic and changes to library services and programs can happen at any time through the advice of the health authorities and the city's emergency management. Thank you, and I'd like to now open this up to questions. As yet, we're seeing normal traffic at the libraries, but certainly as people are more concerned about their health, we'll expect that to change. We would encourage people to think about digital resources. You can borrow ebooks and e-audiobooks from the library using our website and download them to mobile apps, and so that's a great way to still access the library while protecting your health.
Emergency center being activated. What does that mean exactly?
I'll hand that over to Chief Reid.
Sure. So our Emergency Operations Center is it's a team of people from throughout the city organization and other partner agencies that can come together, share their knowledge, share their experience to help, facilitate quick decisions or recommendations to the city on what we need to do for the path forward. So it's a way to bring everyone together to be able to have the right information at hand when decisions are being made, for data to flow into a single point of collection to be assessed and analyzed, for direct liaison with public health professionals and others. And it's, to be honest, a very tried and proven method of assembling your event leadership for major disasters, events, pandemics, weather conditions, all of those things.
So how long has the city had a pandemic planning? I understand the plan has been reviewed. Just a sense of what a pandemic plan looks like?
Yeah, pandemic plans extend back through all the pandemics or different concerns about pandemics that you can remember. So back to SARS as an example, or H1N1 would be some of the examples. And they're always updated because we're constantly learning more in the public health sphere about how viruses behave, how they're transmitted. We live in a more global world now, so there's more potential movement of people and things associated with people throughout the world. So the updates are often about things like understanding what the speed of transmission might be or how a community might be affected. But at the core, these plans have been pretty consistent for a long time.
Could you give us an example, like our city buildings, could they be repurposed for whatever reason? Hospitals get blocked? I'm just trying to get a sense of it.
Well, certainly we certainly would work with our partners in terms of resources that they might need to deal with a pandemic or with an event like this. So, if they have a request to work with us on what might be available for building stock, for facilities, for other types of assistance, then that's exactly what we're equipped through the EOC model to communicate about.
Have you received any guidelines from the federal government? Have you received any guidelines from the federal government?
Yeah, one of the good news stories in Canada is that there's been great alignment between the federal government message, the provincial government message, and the Vancouver Coastal Health message. So that's very helpful. And you can see that there's constant communication between those agencies and between all of the provinces. And in the case of Vancouver, between us and our municipal neighbors and us and other major Canadian cities. So a strength that I've seen so far in the response to the event has been the communication and the consistency of messaging between those types of agencies.
Have you had any problems with funding?
To be honest, we haven't really had the opportunity to broach funding yet. It's early days in the event. Right now we're making sure that our plans are standing up to the tests that they will have and that our teams are assembled and ready to move.
Tell me how your members are feeling. You attend a lot of emergencies, you're first responders, you deal with people who are ill, you have to administer first aid. Are they taking more precautions, or is there an increase in concern about fire?
So a lot of the practices that we follow are the exact same practices that we're asking the community to follow. So lots of hand washing. Our gear is cleaned constantly. Our trucks and all of our medical equipment are cleaned constantly. We do work as a team on different ways of communicating with patients. So for example, if we have a patient who is exhibiting signs of COVID-19, one of our crew members, properly equipped in full personal protective equipment, will approach the patient and talk to them from a distance so that we don't expose the entire team if that was a risk in that particular scenario. And then we work very closely with BC Ambulance Service, of course, on the care and management of those patients. So a lot of it is very consistent practice that we've been doing for a long time, but of course this is an opportunity to re-emphasize the importance of personal protective equipment and good washing principles and staying home when you're sick and all of those other messages that we're also sharing with the public.
Protocols changed at all, Chief, for emergency responders when they get called to, say, a senior's home or a retirement facility?
Just the, of course there's a caution. So again, approaching the patient directly, maybe in a typical environment, might be done by several members of the team, and now we reduce that to one member of the team, and we try to assess from a distance where possible. So to have a conversation with the patient from a social distance away, so that we can gather the information required to make decisions. And I mean, BC Ambulance Service has a leadership role with the patient management itself. So in our first response role, we're just making sure that scene is safe, and if the patient needs some critical care, we can be there to give it to them safely for them and for us.
Have any city employees, I understand there's about 9,000, we have casual, part-time, full-time added up, doesn't include the police workers, but have any city employees contracted virus?
Not that I'm aware of at this time.
What would happen in the case of a firefighter having contracted the virus? They would shut down the fire hall? This idea of self-isolation would happen?
It would be done on a case-by-case basis. So it would really, just again, like the messaging that we give to the public, how were other firefighters potentially exposed to this person who, in this case, is a confirmed case of COVID-19. So the isolation principles would be the same, 14 days after a known exposure, and we would proceed from there. But each hall has 4 crews that rotate through it. So with good cleaning principles in place and careful management, we would continue to keep our halls open.